Recently, our therapy center has received some calls for help from postpartum mothers who are struggling to sleep, plagued by fear, and difficult memories stemming from their labor and delivery experiences. This raises a crucial question. When faced with birth trauma, is psychological recovery truly that challenging? Furthermore, how can family and friends effectively assist these mothers in overcoming their psychological distress? First, what is birth trauma? We need to understand that birth trauma is not limited to physical wounds. It is primarily categorized into two types. Subjective trauma. This refers to the immense psychological impact caused by feelings of pain, humiliation, neglect, or a profound loss of control and agency during the birthing process. Objective trauma. This denotes situations where life-threatening complications or emergencies genuinely occurred during delivery. Regardless of the type, trauma is established when the experience leads a mother to feel, "I was destroyed." Research indicates that approximately 1/3 of mothers experience a high-risk stress event during childbirth, and 5 to 10% of them may develop postpartum post-traumatic stress disorder, PTSD. This disorder involves the solidification of fear memories in the brain. When the birthing process is accompanied by feelings of helplessness and a loss of control, the amygdala acts like an alarm, deeply etching the terror of that moment into the subconscious mind. For mothers who have experienced trauma, their bodies may have returned home, but a part of their self remains trapped in the delivery room. They may exhibit the following symptoms: intrusive memories, uncontrollable, repetitive flashbacks of terrifying moments from the delivery, nightmares and insomnia. Nights become dreadful with recurring nightmares or an inability to sleep due to fear. Hypervigilance, becoming irritable, easily startled, and experiencing an unexplained racing heart, always feeling on edge. Active avoidance, refusing to talk about the birth and avoiding anything that might trigger memories of the hospital or even the sound of a baby crying. Emotional detachment, feeling a barrier between themselves and the baby or experiencing intense guilt for not feeling love toward their child. Self-negation, a persistent shadow of intense shame and self-blame, constantly asking, "Did I not do well enough?" These signs may collectively signal postpartum post-traumatic stress disorder, PTSD. Trauma is like a submerged reef beneath a seemingly calm current. On the surface, mothers continue to embrace their children and navigate life, but the psychological reef, perpetually eroded by fear, is already riddled with cracks. Every cry from the baby, every scent of hospital disinfectants, or even the darkness of night can potentially drag them back to that moment of powerless struggle. However, trauma is not the endpoint. It is a starting point for the need to be seen and understood. I'm supposed to feel happy, so why is there only fear left? This is not an overreaction. It is a genuine, agonizing pain. Just as a broken bone requires setting and time to mend, a wound on the spirit requires time and space to heal. In our next video, we will delve in detail into how can we provide effective help to mothers experiencing birth trauma. Stay tuned.